I'm Latisha Richardson, and I'm with Cardinal Health. I am a clinical implementation specialist, and I help our clients implement the technology tools into their practices and workflows. Value-based care and primary care has years on oncology space. CMS has been introducing value-based care models to the oncology space, and Lightbeam and Javion has been partnering with Cardinal and our customers to try to find a tool to help them to navigate the value-based care model payment plans. With it being really new, our customers need as much help as possible. So with this technology, with this tool, it is helping them be more efficient and effective in reaching out to their patients and giving them the ability to reach out to more patients. When we have tools and technologies that can help us, Lightbeam and Javion giving us better ways to reach out to our patients, that's where our collaboration comes in together. We have some early adopters that have brought in the Javion technology that utilize that AI to look at ED visits. And after adopting the Javion technology, after post-implementation, they saw a significant reduction in ED visits, what actually affects the payment models or the target price that they get paid for the oncology arena. Probably staffing is the biggest challenge, and I know that many of my colleagues talk about that. We have more patients than there is of us. So we have to think differently, we have to think outside the box, but we still have to remain effective and efficient. So our collaboration and being able to think outside the box, utilize our technology, and work together and bring all these wonderful brains together. I think we're going to make a big impact. I think we have a lot of good developers, a lot of good minds, a lot of good ideas that are coming forward. If we can implement those and get those out there into the market, into the hands of my colleagues, I think we're going to make a big impact on patient outcomes. If we can actually get into the ears of our government and our payers and have them understand what we are trying to do with our patients, I think that we're going to make a huge impact. As a former population health nurse, I've done population health in different arenas. So I've done corporate population health nursing, where I actually did transition of care management, in addition to post-acute management. But I also did Medicare wellness visits in addition to transition of care management. But managing the attributed patient lives of 6 providers for one person was a lot. And there was a lot of things that got missed because there's only so much that one person can do. When you have technology on the back end helping you to look at a patient holistically and pulling all of this data together to create a picture and to risk stratify your patients and look at your patients and look at all of these data points and pull all this stuff forward so that you can effectively reach out to your patients and start to address and intervene before something negative happens, that is truly where we want to be. We don't want to just be calling them and utilizing these standardized templates and asking the same questions to everybody because everybody's different. We want to make sure that we are doing individualized care, and the AI, when it looks at these patients and their individualized data points and bring them up and risk stratifies them, it makes it very, very much more effective and efficient conversation for them.